The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. We'll start in a few moments. We'll just give it time for everyone to join. So, welcome to Health Tourism Phoenix, Markets Rising from Pandemic Ashes. My name is Romilly Douglas, and I will be your moderator. I'm pleased to introduce today's speakers, Irving Stackpole and László Puczkó. Irving is the president of Stackpole and Associates, a strategy, marketing, and research firm founded in 1991. Irving is a mentor for the European Institute for Innovation in Health, an EU program to stimulate healthcare entrepreneurship. He edited Medical Tourism Marketing, the first book on the subject, and is the co-author of the Marketing Handbook in Health Tourism. László graduated as an economist specializing in tourism from Budapest University of Economics and holds a PhD on the environmental impacts of tourism from Budapest University. He is a certified management consultant and a past president of the Association of Tourism Consultants in Hungary, CEO and co-founder of Health Tourism Worldwide. Both Irving and László have with decades of experience in health, tourism, wellness. But before I hand over the mic to László, I have a few housekeeping items to cover in today's presentation. First, today's webinar is being recorded and will be made available. We'd love to hear from you from today's presentation, and we'll be answering your questions at the end of the session. If you have a question for our speakers, please feel free to send it through the Ask a Question tab at the bottom of your player on the right-hand side. And if your question is for a specific speaker, please let us know. If we don't get to your question during today's webinar, we'll be sure to follow up afterwards. So without any further ado, I'd like to kick things off and welcome László.
Thank you very much, and very good morning, very good afternoon, very good evening, depending where you are. We're always very, very happy to have you, and especially that we're talking about such exciting topic, which is being a phoenix. And I want to walk you through the ideas that we have in mind and the major topics that we kept for today's discussion. We certainly want to refer to the handbook that we wrote together with Irving as one of the key materials that we always advise anybody to look into, since it has all the hands-on recommendations to situations, especially that we are at the moment. This is the major points for today. What's next? Everybody wants to know what's next, what to do, because we say that the pandemic is sort of over, but may not be as much over, especially countries are closing down again, and you don't know what's happening in the next week. So we are looking into situations where we have people might say that there's a fear of not having any trips booked, and now apparently there's a word for it. And not surprisingly, we know from now experience, since the opening, closing, semi-opening, semi-closing has been going on now for several months and even over a year, what kind of reaction people have when they have the chance to book trips. It could be domestic, but also could be international. To have this opening the floodgate sort of experience when suddenly a lot of people booking trips because finally they can do it, and also looking for more secluded locations, being worried more about the hygienic issues and so on. So these are all very standard situations, but as of now, unfortunately. But the question still is, what's next? What should the industry do? And we agreed with Irving that I do more on the wellness, well-being part, and he will address all the medical related issues. So when you talk about product development, communication, segmentation, and what kind of properties I would look into in terms of development or management, or what direction should my property move, we want to give you a bit of the heads up based on that. We do a lot of intelligence development, and this was done together with the Wellness Tourism Association and IMTJ. And I just want to give you a little bit of an insights to this, and obviously that's available through our web. It's a complimentary download, so I just want to give you a little bit of highlights. What's the difference in terms of traveling for wellness purposes domestically and for international? And you can see that in certain markets, domestic is way more important than international, but there's a relatively good understanding all around Europe, for example, that traveling for abroad for wellness trips, there's something which is an important aspect, and people looking into it, and that people are interested in what kind of options do I have, what kind of products can I have. I think it's absolutely essential to highlight, as we are in the first couple of minutes, that every market is very different as we see it. So just because you're working for a project or a development or company or destination management organization or national government, and you see that, oh, well, this product is popular in that market, therefore I'm going to bring it in and bring it over, please don't do it. At least do it with a pinch of salt, because all these market intelligence that we have been creating for the last couple of years, including during the pandemic time, suggests that the markets do differ greatly, and we will see that in a minute. For example, when you say the Western European market, what kind of facilities, properties, treatments, segments, services may be popular and expected to be popular in the next, let's say, 5 years post-pandemic, this gives you a rather good overview of what you should be aiming at in terms of development, in terms of revision, in terms of expansion. You can see that it's the medical, incorporating medical aspects could be something that leads the way forward, and Irving will look into those a little bit. And what is the medical in that sense? Is it therapies based on natural resources, moving away from wellness, but more like looking at therapies and modalities? What exactly is a medical spa or a medical hotel and a resort? How is this related to the wellness part? How workplace wellness trips going to come along? Are the companies ready to create those trips for their employees? Do they have the knowledge? Do they have the expertise to do that? If not, how it is going to happen? Because this is what the industry is really expecting. Whereas if you look at North America, you can see a totally different picture. You talk about non-invasive plastic surgery, which is more like changing the muscle tones and giving you advice how to train your face muscles, for example, to look younger, and to train it and train every day. Or we talk about spiritual and wellness-oriented festivals, which is very much a North American phenomenon, as we understand. How the eco-spas and wellness facilities may come along. What exactly do you need to do that? How the healthy co-working complexes incorporating work, life, wellness actually going to be profitable, and how you can change existing blocks of building or blocks of offices into something like that. What's the lifestyle-oriented retreat, which is a lovely title, but what does it do? Who's going to define those contents and scope of services? So you can see lots of the changes. Now solo travelers are important, not just women, and segments looking for healthy options. So we have a lot of changes taking place, and the pandemic, if I may, it has a good impact on this, because people are more open. they are interested. And this is when we need to talk to them. And this is when the travel agents and advisors need to change their approach and not just selling it as a luxury opportunity. All that said, wonderful. But look at this title. It's a kind of hospitality's largest bluff, which is wellness. Is it a good thing for us? Is it a good thing for business? Is it a good thing that everything is called wellness? Is it going to help development? How it is going to impact the ones that actually are offering this, and how we can separate this from those who just use it as a label? Don't forget, this is earlier this year, not that many months ago, that we have that discussion going on that this is a bluff. Is it a bluff? Do we do enough to actually set the ground and set the circumstances? So we cannot say that this is a bluff. How we can really separate those doing this for real from those that are using it as a label. I always want to highlight these qualities and understand that there's a lot of over and under in the business. There's a lot of over expectation. There's a lot of overdevelopment and overspending, whereas there's a lot of underperforming in terms of financial performance, as well as guests' well-being. This is why we are suggesting to create not a C-suite, which is the corporate suite where all the various chief executives meet up, but having a W-suite, which is a well-being suite, where equally important decisions can be made, and the C-suite and the W-suite would need to be at the same level and talk about what exactly we're doing for the well-being of the guests. Either those who are coming for wellness purposes, or they're just coming, but we still be able to incorporate wellness improving components. This is when you need some, I would say, if I may, you need help. You need to have advice. You need to have people who understand well-being experience engineering, how it is happening, what is the guest journey. It's not just another bluff, but how it is happening, how you can create the storyboards and the rituals, what exactly I need to do in-house, and so on and so on. Otherwise, we will be focusing on the first three and spend a lot of money on space, but not value propositioning. And I had a discussion the other day with architects, and it's a revelation to many architects when I say, I don't want to build a building. I want to create some value added and value propositioning, to which I may need a building. And not all of them understand what you're talking about. You know, that's in from Italy, it's beautifully orchestrated, suggesting what you need to do, which is like a throne sort of scenario in front of facing a frame behind which there is the nature, which instantly invites guests to sit down, admire, even talk to the one who is next to them. But we all know who those who created this experience understand that sitting down and giving a throne that suggests that you need to sit for longer, framing a frame always suggests there's an art, that you need to be valued, you need to be looked at for a longer period of time. And we know that the end of the experience will be that the heart rate is going to decrease, the cortisol level is going to decrease, and the impact of nature and spending enough time in nature, it's crucial. As you may know, in Canada, as of this year, the GPs can describe spending time in nature on a prescription, which is an indication of how much we're deprived of being exposed to nature. Dressing up a tree, you might say, that was a lovely artwork. Yes, it's a lovely artwork. You may even like it. But the whole idea is that I am creating a situation, admiration of which, or getting involved in which, or being immersed in, would have a great impact on the person's well-being. You don't need to be a wellness tourist. You don't need to be a medical tourist. You need to be a person who could be immersed in that experience. but this is our job, recreating those experiences and situations. And one of the last examples, even if you started reading the 6 Senses Israeli Desert Retreat to open offering a CBD infused camel milk massages. Even if you start, if it's just to put together the various components of this service, you start to think of camel milk and massage with CBD infused in its retreat in a desert. It's in Israel. It's the 6 Senses labeled or branded. This is it's just an example. I'm not necessarily advocating to have such a unusual package or such an unusual proposition, but why not? Because then it would be local, and obviously that's a fusion when you have CBD infused, let's say, camel milk. This is, again, it's an added value there. What the impact of that is, obviously, would need to be checked, but I think it's a good indication of directions. And this is not, again, I need to repeat myself every single time, this is not money. This is understanding what well-being is, understanding how I can contribute to well-being, and understanding how creative and immersive I need to be. So if you are doing any business development or service development, I really invite you to use this approach and check, are you in the service business? Are you in the experience business? Or are you in the transformation business? And if you ask me, this is a sequence. You can't change one day from service business to transformation business. But now when we talk about transformative travel, we are talking about responsible travel. We're talking about contributing to local communities, regenerative travel, and all these new buzzwords. This is nothing new in marketing and strategic management, but I really invite you to revisit your services. If not in-house, then call in an expert and say that, tell me, where am I? What exactly am I doing? Because all this W suite approaches, this is what can help you. Otherwise, you may use this and have this location in your place and bang your head here because you're missing opportunities. The pandemic definitely made well-being as a core topic, and how we are addressing this, it certainly depends on us. So a couple of take-home messages before I pass it on to Irving. Is that there's always another option. There are always other options. Look for alternatives. Don't just talk to someone because a person is a hotel advisor and you want to have a hotel or a spa advisor. You need to find the most suitable approach to yourself. And also makes difference what you wish to charge customers for. Yes, at the end of the day, they pay the check, they pay the bill, but what exactly is it they're paying for? And it's really something that you need to revisit. And the wellnessification, which starts from some very basic steps down to a full wellness oriented travel or service or package, there's a long way to go. And this is the time to visit it. This is the time to check what you have been doing and how you can incorporate this wellnessified approach of anything. It could be a travel management, a hospital, can be a clinic, can be a hotel, can be a resort, can be an airline, whatever that is, because there are ways to do it, but sometimes you need a little bit of nudge to achieve that. So thank you very much for the first half of the presentation, and I pass it on to Irving.
Thank you, László. Enlightening as always, and I hope you can all hear me and see my screen. It's a pleasure to be here. And I feel that the question László just asked, which gets right to the heart of designing consumer experiences and consumer services, what is the customer paying for? So that will come up again when I review the service lines that seem to be returning to life, like a phoenix rising from the ashes. But the question is, what can we expect? business managers and executives, destination management organizations, these individuals and these organizations have a responsibility to try to anticipate what's coming next. And that's what László and I talk about often, and what we consult with our clients about, and what we're attempting to share with you. And sometimes there's clarity in some dimensions, there's more clarity than in others. So let's talk about what can we expect. For most of my comments, I'll be talking in the relative near term, that's within 12 months or so. So what can we expect? Well, we can get to the question of what we can expect in part by looking at what we are for sure not going to see, and we're not going to see this kind of stuff. These are recent headlines taken from publications. The buzz, the hyperbole, the exaggerations are beginning to return to the medical tourism rhetoric online and in public conferences. We're going to have a compound annual growth rate of 30% in medical tourism, or 21% as this other headline states. This is just not realistic, and it's not what we should plan to see, nor what we can legitimately and correctly expect. One of the reasons for that is that the globe, the entire planet, has been wrenched by the pandemic. And the wrenching doesn't appear to be over. We can see here in data from the recovery reports on gross domestic product in these countries, we can see that there's significant variation in the recovery in these economies to the shocks, the dual shocks that the pandemic has produced. So the environment, the very context of asking the penetrating question that László raised, what are consumers paying for, is the context of that is what's occurring in their country. So the source location, the destination location are being profoundly affected by the political and economic events in that marketplace area. The other event, or the other component, has to do with some of the provision of services, factors like labor, which I'll talk about briefly. So one of the opportunities in global public health was the extraordinary, just exceptional rate at which vaccines were developed. And so we had within our grasp the ability to completely squelch this disease, this pandemic, through vaccination, distribution, and uptake. However, there's been uneven releases in the travel restrictions related to acceptance or failure to accept vaccines, the failure to have a uniform system in much of the world around vaccine recognition. We will be traveling the next few weeks, and we are unsure of what to bring with us. So we're just bringing everything, including our vaccination cards, negative PCR tests, and hopefully somewhere in that ream of paperwork, the authorities at the borders will accept what we offer. The other factor has been the public health responses by the governments, which have varied widely. And these are factors that restrict, restrain, or create confusion. And these are factors that impact travel and tourism, and therefore health tourism. So what does recovery look like? Is it return to normal, a new normal, or something else? We believe it's going to be halting over the next 12 months. There will be openings and then restraint. So it's going to be on again, off again in many ways, in many places. And one of the factors that enter into this is the very nature of the markets for health tourism and medical tourism in particular. These markets, as we've presented about before, are not one block. It's not one thing. It's a highly fragmented set of verticals that range from very low impact or very easy provision of service, certain cosmetic procedures, and even the wellness treatments that to which László was referring, all the way up to heart surgery, cancer treatments, very complex. So we can see that the motivations and the obstacles associated with those very different markets impact the recovery and the rate of recovery and how these markets will indeed recover. So there's a real difference between high frequency, low acuity services, simple procedures that are done frequently, and low frequency, high acuity procedures. They're very, very different markets and very different dynamics occurring in the markets. The range of services in medical tourism range from simple low impact diagnostics and checkups all the way up to organ transplants. This is a simple array attempting to display the range of complexity and certainly not intended to be comprehensive, but this bucket of potential services serves to show that there's no one market. It's not one product line that we're talking about when we're talking about health tourism or medical tourism. One of the dimensions that we're certainly encountering in the health and wellness and medical tourism markets is the pent-up demand created by the lockdown. Psychologically and behaviorally, we're encountering populations that have never before been locked down, shut down the way the economies were. People feel constrained. There's extraordinary psychological and social stress that is building up as the result of this. And these human factors, these very human and cultural factors, will find their expression in some very odd ways. I'm certain that some of you have read about the bad behavior of people on airlines. Some people have read about difficult, challenging situations at borders. And these are the kinds of social circumstances that frankly no one could have anticipated, because very few people anticipated the pandemic and how the pandemic would play out with this very uneven, inconsistent pattern of travel restrictions and travel restriction releases between and across borders. But there is pent-up demand. Of course, the issue with pent-up demand is that pent-up demand is not sustainable. Pent-up demand should not be seen as a return to normal. It is just that. It's a temporary surge in the need for services, psychological or physiological, as a result of a lockdown. And to László's point about the labeling and branding of the services being provided and the experience of the consumers who are consuming, whether they are wellness consumers, travelers, or whether they are very ill consumers traveling to receive life-saving treatments, there is a bridge or a chasm to be crossed in the health tourism journey. And this chasm, this journey, just got more complex with the situations presented by the pandemic. And it's up to us as destination management organizations, as health and medical services providers, as wellness providers. It's up to us to understand those shifts and to accommodate the consumer's demands, needs, expectations. So the question goes back exactly what László suggested. What is it that people are paying for? So going forward, what's our coaching to medical tourism, medical services providers who historically have attracted consumers from across national borders, or who are now faced with the situation where they no longer have those consumers or have the volume of those consumers that they once had? What are their options? So there are certainly new markets that can be looked at. That is to say, who is looking for services and why? So there's new service lines, the what are people looking for? And there are new source marketplaces where people can be attracted from. And across all of those three strategic options, there are the dimensions of the channels through which those consumers will be connected to you as the provider or you as the destination. I know we have good representation from both types of organizations in the webinar. And these channels are fundamentally the same type of channel, or predominantly the same type of channel over which we're presenting this program today. They are the new video conferencing services. They are remote. They are services at a distance. One of the limitations to the medical tourism markets historically has been a reliance on a legacy model of the strategy for medical tourism, which was to attract consumers from other destinations to my destination because we have services that you don't have where you live. We have a tradition of providing these services at a higher level. We have those services that simply aren't available where you are, or our services are less expensive than they are where you are. So come on over and receive your hair transplant or your Brazilian butt lift or your other procedure here where it's less expensive. Well, those options may or may not still be available, and consumers, one of the barriers may be fear or confusion that consumers have about their very ability to get to you. And so we need to deal with that principally through communications, and the communications channels include these video conferences. Telehealth, telemedicine, remote care through various biometric sensors and sensing technology will indeed, has been kicked into hyperdrive through the pandemic. It's been extraordinary to watch the growth of these technologies overlapping in medical services, and we'll see an acceleration of that into the future. These things are certainly not going to go away. The barrier, as I've said, is a tactical barrier. We, as destinations or as providers, need to find a way to address consumers' fear and consumers' confusion. Now, unfortunately, in the peer-reviewed literature, there is extraordinarily limited amounts of research that's been done about consumer fear and how consumers behave in the context of fear. Well, there's never been anything like this before, so I guess in a sense that's not surprising. But there is good information about how to deal with consumers' confusion. Much of that research is about having too many choices, so winnowing down choices and making things clear. And I would refer you to some of that scientific behavioral research as a way to determine in your promotions for your destination or your services how to clarify for consumers, reduce the confusion, increase the focus, and package or neaten up what's on offer. And of course, in the past in healthcare, I've been doing healthcare marketing for decades, and we used to never talk about fear. Fear was the third rail of medical services marketing. Well, now we talk about safety. We do talk about safety. We talk about showing safety. We talk about symbols of safety, and these become important, whether they're overt statements about standards and our cleanliness, or whether they're covert representations of our safety through images and other copy. So the who, we can be assured that in the medical services market, the consumers will be more sophisticated. Consumers are now having an opportunity to think about, learn about medical services to a far greater degree. Consumers are getting smarter. They're getting smarter by the week, by the month, as the pandemic wears on. These consumers will be more sophisticated and therefore less price sensitive. That's a challenge and an opportunity in and of itself. New service lines, technology, emerging technologies, cell and gene therapies, so-called personalized medicine is an example, and much of this can be accomplished remotely. Second surgical opinions is another example. There are new source marketplaces where we secure consumers from. Also impacts the level of capital investment, knowledge transfer, and available labor. So these are issues that are resonating throughout the regional medical services markets for international. And who's going to come back first? What about the recovery? So the segments that are coming back, that have already come back, is the vanity. Our cosmetic clinic clients are already have seen for the past few months, a boom in services. There seems to be a certain level of exigency around how people look on Zoom. So there is a surge in cosmetic dentistry, a surge in face appearance enhancing procedures. And the other end of the market that is emerging very quickly is the pent-up demand around high acuity, life-threatening types of procedures, cancer treatments, elective heart and cardiovascular procedures. Those kinds of procedures are indeed in high demand in certain regional markets. And those consumers are very motivated to overcome whatever barriers or whatever confusion is in their way in order to secure the services that they want and need. So what's changed about consumer behavior? There's fear and confusion. There's still a media frenzy about COVID, and now focusing on the irregularities, the lack of consistency between and among countries. What people see in the news has a tremendous impact on individuals' willingness to consider consuming or considering consuming services abroad. Who's not afraid? There are segments that are not risk tolerant, the elderly, the highly frail and vulnerable. Segments that are risk tolerant appear to be the younger, those folks who are seeking cosmetic and appearance enhancing or appearance altering procedures. So who will be hesitant, we can address these by showing our ability to clarify the options for consumers if they want to travel from source location number one to your destination. How do we sort that pathway out for them and make it clear? Same is true with the providers. How do you overcome, counterbalance those fears and concerns by offering, as I mentioned, by offering clarification, symbols, and overt expressions of security, addressing the fear of contagion, addressing the fears related to uncertainty about traveling and traveling to a destination where providers offer services to those consumers. So the take-home messages, a few more take-home messages. The surge of pent-up demand is officially here, and it is not stable. It can go as quickly as it comes. The uneven response between and among countries, across borders, is delaying recoveries. Some segments are more risk tolerant than others. Focus on those which are. That's especially important in order to create a bridge of sustainable business as you go from point A to point B, which is probably sometime late in 2022, early 2023. Some segments are risk averse. We need to show safety as we've never shown it before and create visual and copy related textual proxies for safety. So with that, I would like to pause and suggest that we be available for questions.
Thank you, Irving. And thank you, László, for your informative presentation. So now let's open the Q&A session. I've invited people to ask a question in their Q&A tab at the bottom of on their players at the right-hand side. Irving, do you have any questions there?
Well, one of the questions I'm frequently asked is when. So the actual timing is of interest, and I didn't include a timeline in this particular presentation. The reason for that is that I presented a timeline in a previous program that László and I created, and I was way off. And it's bad business to be wrong at your prognostications, although I have to admit in all humility that I'm not alone. There are a number of economists and cultural experts who were also very incorrect in their estimations of how things would shake out. The EU in 2016 did a study of the economic impact and recovery pattern associated with a pandemic. That actually EU paid for that study, and it's available on their website if they haven't taken it down. They were embarrassingly wrong. They predicted a V-shaped recovery and that things would return to normal previous levels of economic development within 8 months. It's now been many, many more months than that. What's holding us back is, of course, the irregularity in vaccine distribution, travel restrictions, and the public health responses to the pandemic. It seems as though every time we make progress, there's a rebound surge in infections among some group. We're having that now in the United States in children. There's now a surge in childhood COVID cases. So it's hard to say how long. Certainly, we would expect vaccine rollout to have an impact on the comfort level that people have about traveling by the third quarter of 2022. So there I'm on record.
If I may add one point, is that it doesn't necessarily even matter when because it will happen. We know that just because of what Irving said. It's unpredictable. It's more like what we do about all of our existing or maybe planned propositions. So by the time, whenever that is happening, that everything is getting back some sort of normality, I'll be ready. So it's not that, oh, well, I need to be ready in 2 months or 6 months. Yes, probably. But it's more like, do you have all those plans ready? Do you have the homework done? Did you review your existing services? Did you revisit your plans? What had been probably prepared 2 years ago, 3 years ago by one of the standard advisor approaches? Are you open to these anticipated changes, or everybody's hoping to get back to where we were in 2018, somehow forgetting what happened in the meantime, and the same products and services would be offered again, and then hoping that everybody's consuming the very same things in a year time? So I'm a little bit kind of concerned that when I look at all these forecasts and plans and new openings and brand developments, it's, yes, we have certification, then we have this and that compliance for government regulations. Yes, that's legally bound. But where is the brand development? Where is the destination development? Where is the added value? Where is the response? Where is the addressing this new opportunity just because people are more open to hear about well-being, health, wellness, whatever options? They may not buy it, but they happen to sort of know more of it. Just whatever that is, doesn't even matter. We can see new segments coming up. So that's what I think should be really talked about and should be discussed. That how I am as a brand, how I am as a destination, how I am as a clinic or a hospital, I am doing the wellnessification of my services. How I am looking into options, not for medical tourism, but as a service provider, as a hospitality provider, of incorporating all these options, even look into the options and then decide. I'm always amazed that now you can find whichever forecasts and studies that the wellness real estate is going to be this and this many billions of dollars and blah, blah, blah. But sorry, I'm a little bit confused. I thought that hospitality per se should be dealing with my well-being. I mean, that's their job. That's the bottom line. Hospitality is about taking care of their guests, which de facto is directly linked to well-being. But I'm just old-fashioned, and I'm looking into some structures and some, let's say, existing models. And I believe soon, as in really soon, all these properties and hotels and whatever properties would need to provide all those well-being improving amenities and services as an entry-level expectation, not an added value, not something that will improve your rate. It's more like, guys, this is what I expect. I'm not paying more for this. 10 years ago, you could charge for Wi-Fi. Will you pay for Wi-Fi now? You would say, hang on, well, which planet are you living on? This is what everybody does. So all these forecasts that you can expect a 20% increase on your room rates and on your performance just because you're more attentive to the guest well-being, I think is a totally misleading communication, such as the one, Irving, you used, that medical tourism is going to grow by 30% in the next couple of years, which we have been seeing this data for the last 15 years. Every year that the next 5 years is going to be 30%, none of which was justified, obviously. So, these kind of discussions we should really be having with brands and operators and developers and destinations that are we ready?
Yes, and I would add to that, that underlying your observations, László, are the demographic facts that the generation that's coming up is much more focused on authenticity. And what you're talking about in terms of brand, I would suggest one of the fabric elements of that is authenticity. So you can't just slap a wellness label on top of your hotel without having authentic substance and redesigning the experience. You can't slap a label, "We now do medical tourism," on a destination and expect that anyone is going to think that's authentic. You may secure a visitor or two who are desperate, but that's not a sustainable business model. And ultimately, and there are some case studies about this, ultimately that's damaging. Ultimately, that's damaging to the long-term status of a brand to be discovered or exposed as inauthentic. And
what would you say, the CBD infused camel milk to Israel, would it be authentic?
I think it's a trick. I think it's a clever, convergence of the interest in CBD, which is definitely growing. Who doesn't love camels? I mean, they're so cute. Camel milk is kind of tasty. I've had the opportunity to savor it in a few places in the world. And yoga. Okay, I can put yoga and CBD and massage. I can put all of those together, and inside my head, that creates enough dissonance and enough to make me perhaps want to inquire. Whether or not I would do that in that destination, I don't know. So what are your thoughts? I gave you my honest, immediate reaction.
No, it's certainly, it's stopping you for a second. But excuse me, what was that? What exactly is it you're proposing? But obviously that's, it's an eye-catching title in a menu, or it's easily programmable, easily promotable. How about the conversion rate? That's a different story. How many of those actually you can sell? People may try it just for the experience of it. But what exactly am I selling? I'm selling a very good sounding something, or something which says, I'm using CBD for the following reasons, I'm using camel milk for the following reasons, and there's the difference compared to use it, if I use this and this with CBD, it wouldn't have the same impact. So I would need to see the reasons and the benefits as well, not just the title, because the title is certainly eye-catching. But they might say that's easy in the, let's say, in the wellness part. But that's the opportunity here for the more standard medical proposition as well, that rehabilitation, prevention, how you incorporating in a larger landscape, not just treatment in, patient out sort of approach, but you take the rehabilitation is provided either on-site or off-site. How is that relevant to your brand, to your clinic, to your specialist, to your doctors and whoever that is, the healthcare personnel, or the consultant, whoever that is. So going beyond that, and when we do some medical tourism bingo with healthcare professionals, which sounds like stupid. You don't play bingo with healthcare, but I do play bingo with CMOs and CEOs and whoever it is in hospitals, and you ask all those questions, and it's very rare that they actually can say bingo, because they recognize it's a little bit more complicated than they thought. It's a bit of gaming brought into strategic management, but
yes,
this is how you have the aha moment, not just the camel that's saying this is the camel that gave the milk, so meet her. There you go. You can have the direct impact, so you have the immersive experience of the camel. But in the medical services, that you say, oh, hang on, you really understand the complexity of the treatment and the pre and post, and your compelling proposition is way better than just selling a treatment. There's the same as service business, transformation business.
Yes. So we see this in the successful providers who manage to develop long-term relationships with not only their prospects, but their consumers. So for example, it's one thing to do a hair transplant. It's quite another thing to develop a relationship with a woman or a man around their hair transplant and around their grooming. So how do they see themselves? How do they present themselves? How do they groom post-transplant? That's an opportunity for providers to differentiate themselves. Similarly with other procedures as well. I see we have a question. It
Yes.
looks like somebody's just asked. Yes, go ahead, Romilly.
So we have a couple of questions to end with. The first one is, in your opinion, for the discerning medical traveler, what does a good safety message look like?
Oh, what a good question. I think a good safety message has images that show the end state securely. So good safety messages are visual. Some people are visual learners. I happen to be a visual learner. I want to see a masked doctor and a masked nurse interacting comfortably in the clinic setting with a consumer that looks like me. I think that shows comfort and safety. And you also want to carry over certain seals, certain cleanliness standards, and you want to have that text there. You may or may not want to put that in the headline, but it absolutely needs to be there to provide that.
Thank you, Irving. László, any comments on that?
Just one more thing. Visually, yes, but also you need to see the presence. So you need to be reassured that there are people who are actually doing some cleaning activities on site when you're around. So you're reassured, oh yes, I can see it's not just talking about it, actually is happening. Not just a tick on the toilet door that it's the 12, 20 cleanup was done by God knows who. It's 21, I can't see nothing. But you cannot see a person here. But you would see personnel doing some stuff. It's really reassuring that yes, they do clean the chairs or the seats, they do clean the tables. It's not just talking about it.
Yes.
Promising some, and certification, it means very little to most of the people because they have no idea about the standards. You see that's some sort of sprays being used to clean the tables, so that looks very assuring. Oh, good, fantastic. So you need to be promising as well as delivering.
Thank you. And yes, we have one final question, which is, what do the panels think of Malaysian healthcare medical tourism in Malaysia? What can be further improved for Malaysia destination?
How much time do we have?
I mean, you've got 3 minutes.
That's a wonderful question. Irving, you kick off.
Well, first of all, Malaysia has organized their health tourism provision, medical tourism provision, in a distinctive way that, frankly, I admire. Second of all, Malaysia health medical tourism was dependent on an important majority source market, which was rocked simultaneous with Malaysia. And then as things quieted down in the source market, Malaysia got rocked. And then as things quieted down in Malaysia, the source market got rocked again. So the infrastructure is certainly there. They're among the most sophisticated providers in the world. And I'm a great fan. I've been there. I admire them. That's an excellent example of looking strategically to alternative source markets and attempting to vary and extend your service lines. In a minute and a half, that's all I can offer. I'm an admirer of the destination, of the provision, the way it's organized, very sophisticated, high quality, very focused on the patient journey. And so the touchstones along the patient journey. That's all good. I hope László?
I just add something very quickly. I think Malaysia is one of the very few countries I can count on one hand how many countries I would talk to saying that how we're moving into the transformation business, because they understand what they're doing it beautifully. There is the experience, there is the infrastructure, there are the human resources, there's the government support, there is the organizational background, everything is there. So you are ready to get to the next step. With some pilots, with some pilot providers, not depending on the Indonesian market necessarily because of the various limitations, how you incorporate remote and becoming an information hub in certain indications, and not actually patients coming to you, but medical service providers, say in the US, acquiring about certain results of your treatments. And this is what you are selling into other markets. So I think Malaysia is really, honestly, one of the, I don't want to mention others, because that wouldn't be a long list anyway, that would be ready to say that, all right, we've done our homework and now we're ready to step up. You may have less numbers, patient numbers, but the value added would certainly be higher. So that's what I would separate the patient numbers from the creating the next level of Malaysia value added. That's what I would do.
Thank you both.
Well said.
That's all we have time for today, and there are a couple of questions that we didn't get around to answering, which we'll follow up with afterwards. So I want to thank you all for attending, and thank you, László and Irving, for your informative presentations today. Thank you.
Thank you, László. Thank you, Romilly.
Thank you, everyone.
Thank you, everyone. We will follow up with you afterwards. We'll be sending out a brief survey for you to let us know how we did. It's the only way that we can improve our webinars for you. And I wish you all a good afternoon and a good evening. And thank you all for attending today. Thank you all.
Thank you.